Hello, my name is Matthew Lunsford. I did my presentation on the work of Dr. Karola Dillenburger-Keenan. Who is Karola Dillenburger-Keenan? Dillenburger-Keenan is a behaviour analyst that practices ABA and conducts research at Queen's College in Belfast, Ireland. She began her work in October of 1993 and is still currently practicing and researching. On the right you can see a picture of her. This is from ResearchGate, a ResearchGate profile. What and who is the focus of Dr. Dillenburger-Keenan's work? The main focus of her work centers around understanding humans with autism spectrum disorder, how to assist and understand the teachers and family members of the individuals with ASD, and advocacy to increase awareness of the realities surrounding an ASD diagnosis, rather than the myth that prolificates our profession. How has Dillenburger-Keenan contributed to the ABA literature? Dillenburger-Keenan's contributions to the ABA literature have included the clinical treatment of ASD, how to train and educate caregivers, including teachers, and ensuring that behavior analysts are fully educated on the clinical scope of what an ASD diagnosis entails. For my mock interview, I focused on the direction of the ABA field and why it's heading that way, the importance of understanding the psychological impact of ABA treatment for clinicians, and whether or not she thought ABA would benefit from an expanded scope of practice to include diagnosis and the use of other forms of behavioral therapy. My main reason for asking about the scope of practice and the idea of psychological impacts is because a lot of the ABA therapist jobs in this area specify that they want behavior analysts that are also well-versed in the cognitive side of things rather than behavior solely, so that we can get the big picture of a patient's diagnosis and how to best treat them rather than just focusing strictly on the behavior. What are the implications of Dillenburger-Keenan's work? Dillenburger-Keenan's work suggests a couple of things. One, the effects of ABA treatment on caregivers and patients will eventually be better understood, and it needs to be better understood, so that treatment can be better tailored. For treatment for ASD should include the family and all caregivers to optimize the best results for the patient and to help the families cope. And based on what I read, the clinical scope of practice for ABA may very well evolve to begin to understand the clinical benefits of ABA outside of just autism and the full extent of its applications from a clinical standpoint. My references. Thank you for taking the time to listen to my presentation. Hope you found it enjoyable and informative.